Okay, thank you everybody. This is our last presentation for the afternoon. With us now is Jody from REACH. She's going to be talking to us about the 24/7 Crisis Diversion team with Boyle Street Community Services and Hope Mission's Man Down Van. They respond to calls from EMS and EPS dispatch and through 211, including outreach workers, community agencies, and the public. The team provides non-emergency support for individuals in crisis, including the issues with shelter, intoxication, and mental health. Also, too, I just wanted to note is that in the back they will be videotaping all the presentations of today. So if you are interested in seeing any that you missed earlier today, they will be on the library's website over the next week or so. And I'll give it over to Jody. Thank you.
Perfect, thanks Jessica. So yeah, as she said, my name's Jody. I'm the project coordinator for 24/7 Crisis Diversion. And 24/7 Crisis Diversion is a multi-partnership, a collaborative initiative with Boyle Street Community Services, Hope Mission, Canadian Mental Health Association, which operates 211, and REACH Edmonton. We also work in close partnership with Edmonton Police Services and Emergency Medical Services here in the city. Jessica gave a beautiful description of what the program is all about, but I'm going to kind of walk you guys a bit through the history, how we got to where we are, and what's the best way that you can access our services. So the vision for 24/7 Crisis Diversion started way back in 2008. There was a Edmonton Task Force on Community Safety, which eventually resulted in what was called the REACH Report. And in September 2009, the REACH Report was unanimously adopted by Edmonton City Council. And so really what the REACH Report was all about was creative and effective programs and strategies to prevent crime before it actually happens and to meet the needs of the most vulnerable people in Edmonton. It contained 9 community safety recommendations for action and change that were all evidence-based, measurable, and prevention-focused, and it called for greater coordination and access to services and programs for kids, youth, and families. It's really about being innovative, not duplicating services, and doing more with less. REACH recommendation number 4 was a 24/7 service delivery model for high needs populations. And so what we are trying to achieve with this model is improve streamlined agency coordination, collaboration, and communication, more effective, sustained, and coordinated investment of time and money, easier access to services for vulnerable people, and increased feelings of safety for community members in all walks of life. The approach that REACH takes is really about collaboration, partnerships, alignment, and adaptive design. And adaptive design is a really critical component of this current iteration. And so by collaboration, we mean truly working together. And so not just covering shifts to equal 24-hour service delivery, but shared protocols, shared procedures, shared resources, and shared evaluation and measurement tools for the partnership. When we say partnership, what we mean is collective ownership of the initiative. This isn't one organization's program. This is everybody in it together with shared ownership. A big part of what we do is working to create better pathways through the system for Edmonton's most vulnerable people. And so that means engaging really heavily with our stakeholders, the City of Edmonton, Police Service, and Emergency Medical Services, engaging in service agreements with partnerships like Heavy Users of Service, the City Centre Paramedic Response Unit, the Outreach Network, EPL's Outreach Network, anyone and everyone that wants to work with us and any way that we can improve navigating the system for vulnerable people is something that we're interested in doing. I think it's important to acknowledge that 24/7 Crisis Diversion is the evolution of a program that has been working effectively since April 2013. We've been Crisis Diversion since October of 2015, but in April 2013, 24/7 MAP, or Mobile Assistance Program, was actually born. And that program did amazing work and absolutely fulfilled its mandate of responding to vulnerable people 24/7. That was a partnership between Homeward Trust, REACH Edmonton, and the Bissell Centre. So what happened with MAP is that we ran into an issue with scope and capacity. After 2 years, we went back to the drawing board and said, what will it take to expand this program to actually meet the needs of the amount of vulnerable people in Edmonton? And the number that came back was astronomical. The combination of complex caseworkers as well as crisis diversion made it not sustainable, and we had to narrow the scope, and we decided to really focus on crisis. And so realigning and reintegrating the prototype at that time, we were able to expand the scope to meet the numbers that I'll share with you today at about 10% of the cost of what it would have been to increase MAP. So what we're doing right now is all about leveraging existing services. So we partnered with Hope Mission, who ran the Mound Down van, as well as Boyle Street Community Services, who runs the drop-in center, and literally dozens and dozens of other programs to be able to leverage not just the organizations, but the people who work with the most vulnerable in those individual relationships. It's about integrating innovative programs, services, and strategies, and evaluating and engaging multiple stakeholders. Crisis diversion is not a need that ever can be completely filled, and so we really believe that all organizations, businesses, and community members have a role in crisis diversion, and we wanted to be able to improve access for everyone. Another piece of crisis diversion is our 24/7 app. Our 24/7 app is a real-time information system. It was developed as a part of a comprehensive and coordinated response to leveraging existing services for vulnerable people. And it's a catalyst to drive the collection of common and shared measurements for the use of integrative service planning and delivery in Edmonton. So it's a bit of a one-stop shop. It features heavy privacy features, so everything is in encrypted data and on secure platforms. It tracks our time of client engagement, the number of engagements that we have, the location of contacts. It's fully integrated with ETO touchpoints, efforts to outcome touchpoints, to support frontline workers in the field. What that means is that they're able to do all of their data entry and administrative work in real time. They're able to spend their entire shift in the front lines working with people, and they don't have to go back and do any paperwork outside of that. It generates maps and graphs for community and stakeholder reports, which I'll show you in a little bit here. And it actually has an internal dispatch feature to ensure our optimal target response times. So if I'm in Abbotsfield, I'll actually be able to see that another team got a call and I'm closer to it. I can pick it up and get there faster. We're also able to review basic touchpoint information to get a sense of what happened the last time crisis diversion engaged with this client. The 24/7 app is currently being used by 3 programs and 8 organizations, but it has considerable applications in other organizations and areas, and so we're really, really excited to be able to expand it in future services. The primary outcome of 24/7 crisis diversion is reducing the inappropriate use of police and emergency services. So there are over 18,000 social disorder calls every year to 911. So that's everything ranging from, I see someone in the alley, I don't know what they're doing, there's an intoxicated person on my street and I'm not sure what to do. And well over half of those 18,000 calls are not emergencies, and they could be better addressed by connecting people directly to services and organizations that can meet their basic needs, like food and shelter and non-emergency medical care. And so what we want to do is free up police and emergency services for just that, for emergencies. And we want to connect people really directly with the services that they need without getting caught up in the justice system. Working with organizations that are ingrained within the current social support system for vulnerable people means that we can build on existing relationships with both service providers and with vulnerable people themselves. And so this is what the last year has looked like for crisis diversion. So we've had 6,649 client contacts in the first year, so between October 2015 and the end of September. Okay. We've been able to significantly increase service delivery, as I said, by leveraging the existing services and focusing service delivery goals to really, really narrow down on crisis. Okay. Police and emergency services account for over 40% of all of our client contacts. So over 40% of the time when we're responding to a call, we're responding to a call from either 911 dispatch, a direct call from a paramedic, or a direct call from a police officer. And those numbers continue to rise. So we've seen an over 100% increase in the last year. Okay. About 70% of our client contacts are located within the city core. You'll see there's a really, really significant cluster in the middle of Edmonton. One thing that I really want to reinforce is that we are available citywide, and so clients don't need to be in the city and they don't need to be going into downtown Edmonton for us to be able to go out and engage with them. About half of the time, our contacts are happening between 7 p.m. and midnight. So there's a really, really high concentration of contact volume right in the evening time. And about 75% of the time, we're providing transportation. So 25% of the time, we're talking to someone, engaging in conversation, potentially even walking them down the street, providing basic resources like food or water or clothing or blankets. But the other 75% of the time, we are physically moving someone into a safer space. And 6,649 contacts is a lot of client contacts, but it actually represents only about 1,500 unique individual people. So we're engaging with the same people over and over and over again. I mentioned that the 24/7 app does some really, really great streamlining of administrative pieces. What it also helps us to do is to track the revolving door of vulnerable people through human services in this city and to be able to track the gaps in service. And that moving forward will help us to advocate for increased services. In terms of who we see about 3 to 2 male to female, so about 66% of who we're seeing are male. Okay. Over 60% are Indigenous, and over a third of our clients are between 40 and 54 years old. And these are people who experience multiple barriers. So homelessness and intoxication represent well over 60% of our individual client contacts. But we also work with people who have fairly significant physical health concerns and mental health concerns. In terms of what's available from our crisis diversion team, we are available 7 days a week, 24 hours a day, 365 days a year. At this point, we have 5 teams that are operational at different shift times. So in that downtown core area, we have at least 1 team on 24 hours a day. We have what we call the Greater Edmonton team, which prioritizes response times in the north and east sections of the city that runs from noon until midnight. And we also have a south side team that prioritizes White Avenue and everything south of the river that is operational 7 days a week, 1 p.m. to 1 a.m. Okay. So teams respond based on geographic priority to ensure that we're getting to people as quickly as possible. That being said, all teams are available citywide. We also coordinate to provide extra coverage around special events in the city, things like hockey games, concerts, anytime when we think that there's going to be a high concentration of people in an area, we're available around that time. And so at this point, teams are responding to, on average, about 750 individual client contacts per month. And on top of that, we're seeing over 900 what we would call pre-crisis contacts. So that would be, no one's called us, we know someone isn't in need of transportation, we're just seeing someone who appears to be vulnerable and engaging with them to ensure that they're okay, providing with them with some food, potentially a clothing item, and just making sure that they have everything that they need before they actually enter crisis. As Jessica said, we respond to calls directly from EMS and EPS, and then community organizations, businesses, and individual private citizens can access us through 211. Okay. We are wanting to work with people who are likely to come to harm without some kind of intervention. So this might be someone who's not dressed appropriately for the weather. This might be someone who is isolated and alone and doesn't have a way to get to where they need to go. Okay. As I said, mental health or non-emergency medical crisis is a big part of what we do. And we work with people who are intoxicated or otherwise impaired to get them to a safe space. Okay. A great thing about 211 and why I would really encourage organizations and businesses to phone them instead of 911 is that when you call 211 to access crisis diversion, they will physically contact the team while you're on the phone. They'll relay the information that you have to the team. They'll be able to give you an estimated time of arrival, and they'll also be able to collect your information for follow-up from the team so you can know what happened with that person that you called about. A caveat that I think is important to bring up is that this is a voluntary service provision. We are not an extension of the police. We are not city bylaw officers. We are not security personnel. So we're really working with people who want to and are able to work with us. We also don't provide non-crisis transportation. An unfortunate reality in this city is that transportation is a huge unmet need, but we are not able to take people to appointments. We're not able to work with people when transportation is all that is required. But if transportation is part of a solution to make people safe, we will provide that response. And in 75% of the cases, we do provide that response. Okay. As I said, we're not bylaw officers, so we don't ticket people. We cannot force people to move. But what we can do is engage them in conversation to find out what they need in that moment and work to get them the most appropriate referral. And because our teams are staffed by people who have really strong relationships with community members, we're often able to have very productive engagements in that way. We're not a substitute for existing security services, so we can't remove people from private residences or from malls, but what we can do is work with security personnel to ensure that when they find someone who is somewhere where they can't stay, that we can pick them up and take them to somewhere safe rather than just being let off back on the street. So what we do is we provide services to move people from unsafe situations to resources where they can get help for their immediate needs. And vulnerable community members are often hiding in office buildings, they're in malls, they're in apartment lobbies because of inclement weather or because of other unsafe situations. And so we really want to meet people where they're at to come up with a solution for that rather than simply sort of move them along. There are also times when an emergency response is more appropriate. So a huge priority of this program is to divert unnecessary resources away from police and ambulance, but there are times when that's a more appropriate response. So for example, if a person is intoxicated or otherwise impaired, please call 211 and we'll send out crisis diversion. But if a person is overdosed or they're not breathing, that's a call to 911. If a person's confused, they're experiencing a mental health concern, if they're exhibiting some kind of paranoid response, we can absolutely go and engage with that person. But if they're violent or they're threatening violent, that's beyond the scope of what crisis diversion can do. Okay. If they're not dressed appropriately for the weather, they don't have winter boots, they don't have a jacket, they don't have something that they would need to stay warm, that's a great idea to call us. But if a person is sleeping in a snowbank, they need a medical assessment. And so contacting emergency medical services is a better option. Okay. If they're concerned for their safety, so they're concerned that if they leave where they are, they might be unsafe, we're happy to bring them to somewhere safe. But a large group altercation that seems harmful to others is, again, an emergency call. Okay. If a person is sleeping in a lobby, a stairwell, or a public place, for sure, call 211 and we'll work with whoever's there to get them to somewhere safe. But again, if they're exhibiting violent behavior, they're refusing to leave, then that's something that's beyond the scope of what crisis diversion can work with. And so that's what it looks like, right? At any point, an individual human, a organization, or a business can call either 211 or 911. As I said, with 211, we'll connect you to crisis diversion directly. We'll relay that information back, and we'll make a plan for follow-up with you. When you contact 911, they'll take the information, they'll evaluate the call based on their priority dispatch, and if appropriate, they'll send either one of their dispatch units or they'll send crisis diversion, not the same opportunity for follow-up. Okay. The last thing that I want to mention is that starting next week on November 1st, we're going to be launching a social media campaign to make sure people are aware of the service as it's getting colder and colder and colder. So you'll see some of these images being put out in social media, on Facebook, on Twitter. Hopefully the police and EMS will be retweeting them and putting them out there. If you see that, please retweet yourself. We have some cards available on the side here, as well as a bit more information about the program. We really want people to know that we're out there when it's cold, we're available 24/7, and we can help get people to where they need to go. Okay. Any questions? Yeah.
One time I met a person when I was at the market on Saturday.
Mm-hmm.
So I called 211 and he was passed out like in the sun and obviously unable to like move himself to a safer spot
Mm-hmm.
until he was like getting sunstroke.
Yeah.
But because nothing was open on a Saturday, the crisis van wasn't able to come because it wasn't like a hospital thing,
Yeah.
but it was like he also wasn't really able to get himself safe to safety.
Yeah.
So I'm wondering about that, like what would the best thing to do on like a Saturday when
Mm-hmm. Yeah, I mean, to me, that is like a gap in service question that is a huge question. What do we do between 4 p.m. and 8 p.m.? What do we do when the drop-in's closed and the shelters aren't open yet? What do we do on the weekends? The best thing that I can tell you is to keep contacting Crisis Diversion. Our focus for 2017 will be developing more of what we call warm handoff procedures and system navigation. And so our hope is that regardless of whether or not something's open, we'll be able to come out and work with that person and find somewhere. Yeah, Ryan?
I was just going to make a comment. As of November 1st, Hope Mission will be offering 24/7 shelter, so that won't be an issue anymore.
Yeah. Yeah, that's Ryan Harding. He's the manager of our Hope Mission team. Yeah.
Hi, I have 3 questions. I might as well do all in one so I don't have to replan.
Sure thing.
The first is like 24/7, and then like I said, high volume from 7 to 1 o'clock. How many people working at that time when we really need help? That more people working?
Sure. You mean between 7 p.m. and midnight?
Yes, because I'll tell you that my, and also the other one is you show about the app.
Mm-hmm.
And everybody have, as you know, we live in, I'm not saying that, but
Yeah.
home, we don't have,
Right.
and after 6 you can't use the public office. So how they can contact you if there's an emergency?
Sure.
They don't have it.
Yeah, okay. So I know you have 3 questions, but let me just answer so the first question that I heard was, how many people do you have working between 7 p.m. and midnight? Because that is our highest call volume time. We have 3 teams that are fully operational between that time. So we have 6 workers out in 3 vehicles on the street at that time. Additionally, there's another team, 2 other teams actually, that are off at 8 p.m. So 3 out of our 5 teams are operational at the 7 p.m. From the 8 p.m. to midnight, and all 5 are operational between 7 and 8. So we do have a really high concentration of service available at that time because we know it's our peak time. Okay. The second question that I heard you ask was about our app, and maybe I wasn't quite clear. Our app is a tool that's used by our frontline workers. So this is not an app that's available for individual download for people to dispatch crisis diversion. In order to access crisis diversion as a community organization or as an individual citizen, calling 211 is the best way to access them, and 211 is available 24 hours a day, 365 days a year as well. And so they have a direct line to crisis diversion. Okay? Okay.
I have no experience because when I called at 1 o'clock for my husband, I was okay. My husband need help.
Mm-hmm.
And I called. And one of the workers said, well, we don't deal with that kind of call, not emergency police. So I called crisis mental.
Mhm.
I see the same. I will see where I'm going to because I've been putting call that because we're not dealing with it. Call this one because we're not dealing with that.
Right.
Call this because we're not dealing with it. So that's the diagram. I'm just looking at it because that's what I went through.
Mhm.
And if we want to save for our people that really vulnerable, like you mentioned, people, I think we better have a good service. A good, if you are the advocate for people that now you do this. I mean, I don't have direct contact with the government, so for the city that maybe like could put more workers
Mhm.
that will save more people.
Mhm.
Like for being there before we get the access.
Right.
You know what I mean? So what we really need, I think, like myself, when I need it, I can't get nobody.
Yeah.
And so I think it's like more people in the field, never mind about cutting back. It's about like, that's what I would say for crisis. I would say that's the best things to say that more people that will answer the phone
Mhm.
to save those people and they get response and they don't get like, call this number. Call
Yeah.
This number. This is not number, did you call this number? You end up in the same person. I think we don't serve that.
Yeah, no, and I can hear from your story how frustrating that was to get the runaround, and I'd love to take some time just off the side maybe to go offline and chat a bit more about what happened there, but I really appreciate what you're saying in terms of wanting to improve access to services, so thank you.
We really do.
Yeah.
And of course, like, I take the bus. Okay, I take the bus as a for commuting. And also, if I deliver that to you or to the city, the problem is like 10 or 11, I take the bus. There's a lot of homeless wanting to use
Mhm.
bus.
Yeah.
And some of the bus drivers don't let them in. And I have a spare change myself and little plastic.
Yeah.
Let them in because it's late. So is that, like I'm doing my part to the community to save those people. They said they don't know places to go, they don't have the money. And like I said, I'm not gonna call you guys for $6 or $7. Is there like after like that kind of time, like nighttime?
Yeah, 24 hours a day. So if you don't have any change or you see a bus driver not let somebody on and you're not sure what to do, you can contact 211 and give that information to their dispatchers and we'll go out to that bus stop. I really want to reinforce that this service is available every hour of every day on every day of the year. Every single hour of every single day. Okay? Any other questions about crisis diversion? Awesome, thanks.
Okay, thank you very much, Jody. I will stress that this is our second Downtown Resource Fair. This is the first year that we've had presentations. If any of you have a little bit of time, there are at the front desk where Laura and the library are to provide feedback. We hope to run this every year. It's a joint effort between the library, Reach, Bissell, and Boyle, but we can't really improve anything if we don't get feedback on what you guys liked about it, what you didn't, what you would improve, things like that, especially around the presentations. And that is all for today. Thank you very much.